Hi, my name is Ed and I'm going to be your nurse for today. Today I'm going to be showing you how to do a head-to-toe assessment. I'm supposed to have my husband Ray to be my patient today for my head-to-toe assessment, but because for the past couple of days I've been working in a COVID floor, so we're actually trying to keep our distance even inside our house. So for right now I'm just going to use my favorite toy, it's Gigi the giraffe. So my patient's name today is Gigi. So before I go to my patient's room and do the assessment, Gigi just came in and admitted in the hospital in our floor. Before I go in, I make sure I gather all my supplies that I need, bring my computer, um, all the supplies that I needed for in order for me to perform the head to toe assessment for her today. Hello, Miss Gigi. Good afternoon. How are you doing today? She's fine. My name is Ed, and I'm gonna be your nurse for today. Today we're gonna be doing a head-to-toe assessment. Is that gonna be okay? Okay. While we're doing our assessment, we're also gonna be exposing some body parts of your some of your body parts. Is that gonna be okay? Okay. But before we proceed, I'm gonna go ahead and do some hand hygiene. I did my OE wipes, and that includes giving my patient also a privacy. So to make sure I close the curtain for privacy, and I want to make sure I raise the bed into a position that's comfortable for me while working or we're doing the head to toe assessment. So before we proceed, I'm gonna go ahead and make sure I have the correct patient. I'm gonna open the computer and ask, can you tell me your name and date of birth, please? While she's answering my question, I'm also gonna be checking her wristband to make sure she identified herself correctly. So I got the name and the date of birth correctly. Miss Gigi, you know where you're at right now? You're in the hospital. You want to make sure you check for her level of consciousness. You know what time of the year, what season of the year is it right now? It's springtime. Oh, thank you very much. You know who's the current president of our country? Oh, okay. Thank you very much. And what is the reason why you came in here to the hospital today? Oh, okay. So you're having shortness of breath. Oh, okay. All right. So around this time also, if you want to check if the patient is in oxygen, you want to make sure she is on the correct amount of oxygen as per doctor's order. And if the patient is also on a, if the patient has a catheter, you can also check on the catheter and you can assess the quantity of the urine in the catheter. You can also check on the color and consistency of the quality of the urine. And at this point in time, you can also you can also perform your vitals. So you may want to check the temperature, blood pressure, the respiration rate, and the heart rate as well. Although later on, we will also be listening to the heart sounds and at the same time and listen and count the pulse rate. Um, and before you do your assessment, you might want to also ask if the patient is in pain. That's the fifth vital sign. Ms. Gigi, are you in any pain right now? Okay. If the patient is not in pain right now, but if she's in pain, you can also ask for how is she gonna describe her pain. How do you describe your you can also, she is not in pain right now, but for patients who are in pain, you can also ask for how are they describing their pain, if it's pain, if it's aching, stabbing, or any words that they can describe their pain. You can also ask for the location of their pain. Where is it located? You can also ask for when did the pain started, the duration of the pain, and any alleviating and aggravating factor. And of course, you might want to ask for the level of the pain as to you can use a 0 to 10 numeric pain scale. But for now, my patient doesn't have any pain, so we can go ahead and do our head to toe assessment. All right, Miss Gigi, we're ready to do our head to toe assessment, okay? While you came in, when you came in and talking to the patient, you kind of actually inspect the patient as well on her grooming and how she presents herself, her skin color or her cultural background as well. Um, okay, we're gonna be inspecting the head, the neck, the face for symmetry. And now when we are inspecting the head, you can actually wear gloves as well. So I'm gonna be wearing a gloves. I wash my hands and wear my gloves. I'm gonna just go and gently check in the head, checking for any signs of lesions or any signs of unusual bumps or lumps, and at the same time checking for the growth of the hair if they're equally or evenly distributed. And did you have any problem with your problem with your hair or your head? No. Okay, thank you very much. At this point in time, you can actually go ahead and check and inspect the eyes and assess her eyes. Um, for the eyes, you want to see and check for Perla. Check her pupils if they are both equal and they react and if they react to light, if they're round, if they react to light and they accommodate as well. Okay, Miss Gigi, I want you to go ahead and look straight in my finger. Okay, I'm just gonna inspect your eyes. Okay, if you can follow the go straight, look straight and follow the pen for me. I'm checking for accommodation. Did you have any problems with your eyes or any history of problems with your eyes? Do you wear any glasses at all? No? Okay, thank you very much. When you're done with that, you can go ahead and inspect the nose as well. How about your breathing? Did you have any problem breathing? Oh, that's your main concern right now. How about like smelling? Can you smell very good? Oh, okay. Okay, can you tilt your head a little bit? You want to make sure you check in the nose, checking if it's patent, and you also want to see and check if there's any obstruction and any signs of septum deviation. If that is good, then you can go ahead and check on the mouth. You can ask the patient to just open the mouth and say, ah. Stick your tongue out and say, ah, for me, ah. Okay, very good. While she is also opening her mouth, you can actually check the mouth as well. Checking for color of the mouth, checking for the color of the mucous membrane of the mouth, if it's pink, if it's dry, or if it's moist. You also would want to check the teeth, the color of the teeth, if they're still complete, if there's any problems with the teeth. And you can also smell and check and if the patient has any like has having any halitosis or any odor as well. Okay, you can. Did you have any problem swallowing or chewing? No. Okay, you can also actually you can also ask yourself to see, ask your patient if she can like puff her cheeks, just to make sure that the facial nerves are working. At this point in time, if everything is good in the mouth, you can go ahead and check on both of the ears, checking for the if they're equal in sizes, if their colors are okay, and you want to see if there's any signs of developing sore at the back of the ears. And then you go ahead and inspect the ears by pulling the pinna backwards and up. You will want to see and take a look in both ears if they have any earwax build up, if there's any like obstruction. Did you have any problem or trouble with your hearing? No, you hear perfectly fine. Okay, seems like my patient is responding very well, so I assume she can actually hear me pretty good. Um, how about your balance? Did you have any problem with balance? Oh, okay, very good. At this point in time, you go ahead and check on the neck. Okay, you may want to check and palpate, gently palpate the trachea. Want to make sure that the trachea is not deviated, and at the same time, you also would want to feel any signs of swollen lymph nodes. If there's none, you also would want to check on the skin actually of the neck. And at the same time, you can actually palpate the carotid pulses just one side at a time. Okay, so when you're done with the head and the neck, you can go ahead and check and listen to the heart sounds. Now, this time, you might want to just let your patient know that you're going to be exposing the upper body part, her upper body part. Okay, before you auscultate the heart sounds, listen to the heart sounds, you might want to just check on the skin, checking for any signs of dryness. You can see, you can actually pinch the skin just gently if there's any signs of tinting, which is actually an indication of dehydration. See if the skin is good and intact, there's no any lesion. You can also feel also the skin if it's too hot or too cold. And then go ahead and listen to the heart sound. You're just gonna be listening for the heart sounds. You want to make sure there's S1 and S2 and there's no like S3 and S4. If there is, then you're gonna have to put that in your documentation. You're listening to the apical pulse of the heart, which is in the fifth intercostal space, mid-clavicular level or line. When you're listening, you want to make sure you listen for a full minute. And checking for the and listening for the lub dub or the S1 and the S2. Did you have any problem with your cardiac problems or or any problems with your heart? You have any history, your family history of heart problems? Oh, okay. There's nothing? All right, thank you. At this point in time, you might want to also, when you're done with check-in and auscultating and listening to the heart sounds, you can actually go ahead and check for the lung sounds as well. I'm just going to go ahead and listen and to your lung sounds, okay? You want to make sure you don't hear any adventitious or irregular heart sounds like not heart sounds but lung sounds like crackles, any wheezing, or any bronchi. Before you listen, of course, you have to make sure you check the skin and inspect the skin. So, when listening to the heart, you want to make sure you listen to all the different lobes of the listening to that. I'm sorry, listening to the lungs. You want to make sure you listen to all the different lobes of the sides of the lungs. Okay, and then you might want to ask your patient to do some deep breathing. Okay, breathe in. Thank you. Okay, one more time. Very good. 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 One more time. Very well. Okay, when you're done listening to the lung sounds, you can go ahead and inspect the stomach as well. You want to make sure you check and look at the stomach and check for its size. And also you want to make sure you inspect for the skin as well. Okay, after that, you can actually listen to bowel sounds. Before you auscultate on her abdomen, you can actually ask if she has any pain or experiencing any pain in her stomach. Because if she has a pain in any quadrant of her stomach, you might want to just do and auscultate that last. Okay. If she doesn't have any pain in her stomach, you can go ahead and auscultate the stomach. You start from the lower right quadrant of the stomach. then the upper right quadrant, the upper left quadrant, and the lower left quadrant. You want to make sure you listen to the bowel sounds for 5 minutes. And if you don't hear anything, or if you hear anything that's not regular, you might want to listen for the full 5 minutes per quadrant. And then after that, you can actually go ahead and palpate as well. You want to make sure there's no any rebound tenderness, or there's no any distension, especially in the lower part where it's close to the bladder. Okay, if that is done, then you can go ahead and check on the extremities, the arms or the upper extremities. Before you do and inspect that, you can actually just make sure you can actually lift both arms. Are you, Ms. G, you can actually ask your patient as well if she's able to like lift her shoulders, her arms pretty good. Are you able to move your shoulders and arms pretty good? Yes, okay, very good. It seems like my patient has a very good range of motion. You might want to inspect the skin. Okay, the skin on both arms. And you want to make sure you feel the pulses in both arms and compare it. You want to compare the pulses both for rate and regularity of the pulses. Okay, everything feels everything's good. You might want to check, you also go ahead and check for each fingernails, checking for capillary refill. Okay, on the other side. Okay, you also inspect, don't forget to inspect the skin and the arms. You might want to also feel for any, the the warmthness of the skin or the temperature of the skin. Okay, if it's both are good, you might want to go ahead and check for the arm strength. Can you push my hand? You can have the patient push both of your hands at the same time and then pull. Push and pull just to test for the patient's arm strength. Um, Before I actually forgot also, if your patient is able to like just sit down when you're doing your inspection or your assessment, you can actually, after you did the anterior part or the front part, listening to the lung sounds, you can also have them just check and listen to the lung sounds on the anterior part and the posterior part or the back part as well, if they're able to sit. But if the patient is in bed, so you can just do the back one last. So for this time around, I'm just gonna do it last because my patient is in bed. Okay, I'm gonna go ahead and open up the lower portion of her body and check on her lower extremities. While doing that, you could also would want to check on the perineal area, checking for her skin or any signs of skin abrasions or skin excoriations or any lesions as well. Or if the patient is incontinent, you want to make sure that she is dry and not soaking wet, so you avoid any sores to develop, especially in the perineal area. You want to make sure you check on the legs while you're going down from the knee downwards. You might want to just gently palpate the legs, checking for edema. If there's like edema developing, you can actually check if it's pitting or non-pitting edema by just gently palpating it. At this point in time, you can go ahead and feel both of the dorsal pedis pulses. Feel it for 1 minute. And at the same time, simultaneously, you also would want to listen and feel for the posterior tibial pulses as well. When you're done with that, you can check for the capillary reflex of the toenails, the nail beds of the toes, and inspect for any developing sores on the legs and on the heels. If there's none, then you can do and check for the leg strength by doing the push and pull test. Can you push, Gigi? All right, can you pull? Okay, very good. Now that we're done on the anterior side of my patient's body, now we can go ahead and check on the posterior side or the back. At this point in time, you can actually listen to the lung sounds of the posterior side. Before listening, you can actually check for the skin as well, and then you go and auscultate. You wanna go and auscultate on the eight like on both sides of the lungs. Okay, deep breathe. All right, thank you. One more time. Thank you. Thank you. Thank you very much. After that, while the patient is actually on her side, you go ahead and check for the sacral region. You want to make sure there's no developing sores on the bottom or on the buttocks and on the sacral region as well. Now, when you're done with that, you can go ahead and have your patient be comfortable in bed. Cover her with the linen, put the gown back on, cover her with the blanket, and make her feel comfortable. You might want to ask her if everything is okay, if she needs anything, and if not, then you can go ahead and put the bed down all the way down, so you make sure your patient doesn't fall out of bed. You might want to make sure you give her call light for safety. A call light if she needs anything, so she can call you. Needs anything, you make sure her personal stuff or personal items is close to her if she needs them, her cell phone and everything. And you can also put the side rails up, but you have to do it according to your facility policy as well. Okay, Miss Gigi. So I guess we're done with our head to toe assessment for today. Thank you very much for letting me help you and do my assessment today. Did you have any questions? If the patient doesn't have any question, you can go ahead and do some hand hygiene and document your the assessment that you did today. If you find any something irregular, or even if they're all normal, you want to make sure you document everything before you leave the room, and you want to make sure you check your patient from time to time on your shift, and that she's comfortable, and you give her whatever she needs. All right, thank you very much. Thank you very much, and you guys have a good day.